Hi everybody, this is Rhys Barber from Audiology Associates. Thanks for watching our earwax removal video today. In this video, I'm going to be talking you through the procedure of removing wax from 3 of our patients that came through the clinic this week. So in today's video, we're going to have a really sticky earwax, we've got a retracted eardrum, and we've also got a nice long skin peel for you. So without further ado, we'll go into the first patient. So what you can see here, this patient's come in feeling very blocked up on one side. We've got this very sticky earwax. So this is actually stuck to the canal walls all around the outside edge here. We've also got quite a narrow opening to the ear canal as well, which is what's stopping this wax from migrating out. Now, what you can see me using here is the standard size Zollner tube, so a very fine sort of tube that we pop just inside the ear, which is attached to a suction pump. And what we're doing at the moment is just teasing this wax away from the outside edge of the ear canal. Now, because it is very sticky, what you do tend to find happens is that that wax will, as you try and move it, re-stick to the canal wall all the time. So what we're having to do here is kind of wiggle it just ever so slightly, just to try and draw this down the canal. You can see we've got a good grip here on this outer section of wax, and I'm very gently teasing this out of the canal. So what the patient's experiencing at this point, it's it's quite a bit of noise in the ear really, so lots of rushing and roaring, maybe some crackling and popping as little bits get sucked inside the machine, but not painful at all. Just lots of pulling sensations here on the outer part of the ear canal. So you can see now we're just starting to sort of wiggle one little piece away. There we go. So you can see that stretch away, this kind of very sticky natured earwax, pulling and stretching out of the canal as it comes away. Now we're just going to go in now and get the next section. The good thing about this particular type of earwax is it does tend to pull the next piece of wax forward. So as you draw this down, because it's very sticky in nature and it kind of stretches out, as it pulls on that wax, the next piece of wax will move forwards, and that will allow us to just very slowly start to work this out of the canal. So we've got the next piece to the outer section of the canal here. Just trying to lift off the base. There we are. You can just see it's starting to come away here. We've got to maintain suction, so we've got to stay on this wax for it to keep pulling out of the canal. But there we are. You can see it's just starting to get these bigger pieces coming forwards now. There we are, just wiggling it from the top, just unsticking all these edges around the earwax here, giving it a bit more of a wiggle. There we are. You can see that next section's come forward as well. So we can go back in now and grab that with the Zollner tube. There we go. And now we're really starting to get some movement to this wax. It's really starting to come out the canal now. So we're just getting this last couple of pieces away. Nice big chunky bit there. Now a lot of this, because it is a little bit softer and a bit more sticky, a lot of this will actually get sucked inside the tube and end up in a tank where we collect everything then. But what you can see now as we go back in, there's the eardrum there looking nice and healthy. It's very shiny, very pearlescent. It's a little bit of sort of tidying up to do around the outside edge here, just taking some of these looser bits of debris around from the outside edge. There you can see what we removed. So we've measured this out, so just under 2 centimeters, 3/4 of an inch there, and there will also be a few little bits and bobs that got sucked inside the machine and ended up in the tank as well. So in a second, we're going to move on to our second patient. So here they are. You can see here we've got not completely blocked in this ear canal, but quite a bit of the ear canal is actually has covered up here. Now this wax looks a little bit shiny. You can see that as we shine the light in, you're getting some of the light bouncing back, but the wax itself is very hard. Now that sheen you can see does happen sometimes when the wax sort of dries out and hardens up a little bit. Now, as we lift with the tube again, you'll just see a whiter material underneath. Now, that whiter material is actually a little bit of dead skin. You'll see that in a bit more detail now as we draw this down. There we are. As we lift this up, you can see that whole white layer there. Where the wax has been stuck on top of the canal wall, it's formed this sort of, this dead skin layer is kind of built up underneath it. So we're trying to draw this down. That's very soft, that material, but the wax above it is very hard. So you can see it's just a bit too big to fit out easily from the ear canal. So it's going to take a little bit of maneuvering, a little bit of wiggling happening here. There we are, starting to draw this down. Not going to come out. So we're going to switch tools now. We're going to use a Jobson horn, which is like a little spoon, if you like, for wax with a hole in the middle. So we're just going to draw this out of the ear canal now. There we are, it's popped out. We're going to try and pick this up using the Jobson horn. You can see this white material is kind of interspersed within that wax. So that dead skin's kind of ended up all the way through it, and it's dried around that skin material there. But yeah, quite a big plug there. And when we take a look at this patient's ear canal, you can see it looks very different to the patient before. Now that's because the eardrum in this case is drawn into the middle ear space. It's what they call retracted. So what you can see is the hammer bone there diagonally in the center, and these retraction pockets either side and above as well. When we get reduced middle ear pressure, it does tend to draw the skin of the eardrum in a little bit. So that patient would be experiencing a lot of popping in their ears and some reduced hearing as well. So we had centimeter there, just under ½ an inch that plug was. So it was quite a big chunk as well that came out of the ear. That retracted eardrum that you saw there will resolve itself in most cases. I mean, that one there looked as if it was kind of particularly long standing, so that patient's had a little bit of difficulty for a while. But yeah, in most cases, when you get that popping in your ears, it equalizes the pressure and the eardrum pops back to normal. So this is the last patient in the compilation. So this is the patient that had the skin in their ear canals. Now, when you first look at this, we've got this solid wall of what at first appears to be wax. But as I'm getting a grip on this with the suction tube, I can see that it's not giving very much. So we're going to switch to the Jobson horn now. And we're going to pop this over the top of the wax, and we're going to use it just to draw this out. But as we take this away and fold this front section down, what you'll notice is that we were expecting to see a plug, but it didn't really come out that way. And we're starting to see this whiter material collecting around the end of the Jobson horn as we pull this forwards. You'll see why now in a second. As we drop this front section down and take a look behind it, which we'll do in a second. We'll just take this little piece away here. There, just behind it, you can see there's this long piece of skin that's actually dried in there. So this is actually a piece of skin that's hardened on the front end, and we've got this long kind of ribbon behind it. Now this is still attached to the canal wall, so we're just going to draw this out with a set of what they call crocodile forceps, these little forceps you can see me using here. Because the skin is quite tough, as we draw this out, look, you can see this long strip behind it. Now the skin in the ear canal grows very differently to the skin everywhere else on the body. So the skin in the ear canal grows laterally, so it grows the full length of the ear canal. So when you are starting to draw these little pieces away now, you will actually be taking skin from a little bit deeper into the canal as well. So if we take a look in here, it's a little bit misty at the moment. It does happen sometimes if the ear canal is particularly humid, but you can see this flap of dry skin we've got here at the base of the canal. So we're just going to get a grip on this with the forceps, but it wasn't really pulling out very easily. So we'll go back in now with the Jobson horn and press very lightly on the top of the skin and try and draw this flap of skin out. Now, the reason we're pressing lightly on this is because the ear canal walls are very, very sensitive. So if you press really hard on there, it can be really uncomfortable for the patient. That's the last thing we want here. But when you take a look behind it, you can see a little tiny bit of dry skin dangling from the top there, and the eardrum itself looks nice and healthy. So this is the patient's second ear here, so obviously the other ear canal. And what we can see is that we've got a very similar story on this side. So we're just going to go straight in with the Jobson horn here and fold this down. But when you look at the beginning part, the entrance here at the canal, this is more like a wax, a thick, brittle type wax here. But then as we pull this down, very, very similar story to the other side, you'll start to see this long ribbon behind the ear. You can see it. It's actually detached away as we pulled this out. We're just trying to wrestle with it here just to give this a bit of a lift. There we are, now that comes. And when we take a look behind, on this ear canal, you can see a much clearer idea of what's going on here. So the skin in the ear canal is basically, it's all coming away just at the entrance in the sort of outer third of the canal, but it's lifting away this long flap. Now, as the wax migrates over the top of that, it's going to dry around that flap and hold together. And on this part, we're using the Jobson horn here just to take those little bits and those flaps of skin away, just to try and sort of nip them off at source, if you like, so it stops it from recurring quite as quickly again. This patient does tend to have their ears cleaned up roughly about every sort of 12 to 18 months thereabouts, and it usually is this kind of skin debris that's coming away. So we're just getting a really good grip on that last little bit. Out it comes. Now you will see, I'll line it all up for you in a second, but the eardrum looks nice and healthy. You'll see in a second how long these strips were. So we've got, what's that? That's 5 centimeters, just over sort of 2 inches thereabouts, and you'll see each of these pieces here along these strips were these pieces of skin that go into the ear canal. Don't forget the ear canal is about 2.5 centimeters, an inch long, so you will get some really, really long strips occurring. Well guys, I really hope you enjoyed that video as much as I did voicing it over for you. As always guys, take care of your ears, take care of yourselves, and take care of one another. We'll be back again for a video on Friday, so I'll see you then.